Hello, my name is Christine McNair. I'm a graduate student at Rowan University, and I'm going to present to you today the APN Entrepreneur. I'm going to discuss topics such as my introduction, the applicability to the nursing practice, the applicability to anticipate a career trajectory, a description of the nursing issue and why is it a trend, and where to begin. We're going to investigate the business aspect, practicality and usefulness of starting an independent home care private practice that's owned and operated by the advanced nurse practitioner, and why this is useful to the elderly population. This type of business is continuing to gain popularity, and according to the Centers for Disease and Control and Prevention in 2004, almost 1.5 million patients were receiving health care in their homes, up from only 7,200 in 2000. The CDC also reports as the increase of home care services expanded, the expenditures more than doubled from $13 to $30 billion. In New Jersey, an APN can diagnose and treat patients without a collaborating physician, but a physician is required to prescribe medications. According to Yee, Bocus, Cross, and Samuel, state laws vary widely in the level of physician oversight required for nurse practitioners, with some states allowing NPs to practice independently, while others limit NPs' authority to diagnose and treat and require a physician for medication. Currently, 18 states allow APNs to diagnose, treat, and prescribe medications without physician permission, and that includes Maryland. In 2010, Naylor and Kurtzman reported that the average cost for the APN visit is 20 to 35% lower than the cost of a physician, thus saving Medicare money again. Arabak did a study in 2012 which projects the APN workforce will continue to expand at a steady rate, reaching 200,000 by 2020 and 236 by 2025. At the time that study was conducted in 2012, there were 128,000 APNs. Why will this work? Well, because the population is living longer. They have longevity. It makes sense to provide healthcare in their home, right? It allows the elderly to remain in their home and have healthcare come to them. It decreases transportation costs and provides convenience to the elderly. It also could prevent rehospitalizations as the patient knows that their healthcare provider will come to their house, either for a routine visit or if the need should arise spontaneously. An advantage of seeing your patient at home is assessing their environment. You can assess safety and sanitation issues and ensure compliance with their medications. Oftentimes, the elderly are forgetful of the medication regime. Home care visits could help ensure medication compliance by perhaps pre-filling the MediPlanners. I have a patient to whom I do home care hospice visits. This patient lives alone with family popping in and out occasionally. I fill her MediPlanner twice a week. If that wasn't done, she would not take her medications. Her short-term memory is so poor, if I am there for a half an hour, she would have asked me 10 times about the weather. So why does this relate to my career trajectory? Well, my 5-year plan was to complete my master's program, become an NP, and open my own business. According to the American Association of Nurse Practitioners, 19.5% of NPs are in private practice for themselves. My mentor, Ivy, has such a practice. Ivy shared with me that going into practice for herself was the best decision she ever made. Because it is a New Jersey practice, however, Ivy has a collaborating physician. In 2013, Lucas concluded that this type of home care service offers several advantages. It reduces the capital which is required to establish a clinic. It offers the opportunity to assess patients in their homes, which allows a more comprehensive picture. It avoids potential noncompliance in treatments and follow-up visits, since the APN will be making home care visits. Barberio reported in 2010, being in practice for yourself provides the opportunity to specialize and maximize the care of the client, as well as the time to provide the educational base necessary to enable the client to become a true partner in healthcare regime. Robnet reports that with the expanded state scopes of practice and direct reimbursement from Medicare and other insurers, more nurse practitioners are opening private practices than ever. And franchising. Not only does Ivy operate out of New Jersey, she recently opened a clinic in her hometown in Nigeria. So where do we begin? How does it all start? Barberio in 2010 said in order to be successful, financial self-sufficiency is the #1 issue to address from the beginning. According to Ivy, her initial startup fees were only $5,000 because she started her practice in her home. That was in 2011 with only a few patients. Now, she has an office with a complete administrative staff and 4 additional APNs on staff. She now services over 300 patients. Her collaborating physician accepts a stipend of $8,000 annually. The practice accepts Medicare, Medicaid with other insurance, and she does private pay. Barbario in 2010 reports there are many aspects to consider prior to printing business cards, from selecting a location, determining startup costs, developing a business plan, and obtaining necessary licensures and collaborating physicians. Bubert in 2006 reports to become a Medicare provider, you will need to apply to the Center for Medicare and Medicaid Services to receive an NPI, that is a National Provider Identifier. The NPI is a unique 10-digit number that is used for your identification. This should be done as soon as possible, as it may take a few months to receive. Barbario in 2010 reports recruitment is essential. Hiring the right colleagues is a major factor when considering your startup plan. This provides an opportunity to work with the people you respect and who you share your philosophy of healthcare. Ivy reports her staff is the backbone of her business. When asked what makes her business successful, hard work, delivering on my promises, and providing services that set you apart from others, Ivy reports. Ivy received Top Nurse Practitioner Award in Magnolia, New Jersey in the years 2015 and 2016. Her business, Medical House Call Associates, is also 5-star rated with 100% concerns addressed, and 100% of people who reviewed Medical House Call Associates would recommend the practice to others. With Ivy's expertise and commitment, I am sure one day I will be just as successful as she is. This is just a slide that I downloaded from the Advanced Healthcare Network for NPs and PEs. It really gives you a nice clear picture of the 9-month out on what to start on first. So class, let's keep working towards our goals and see how successful we all can be. Any questions?